Most patients are so relieved when I tell them they don't have to floss. Because we've all been told that for years, that flossing is so important.
No one wants to.
No one wants to. And I think it's like 70% of Americans know they should floss. Only around 30 or 35% floss.
Yeah.
And I think those are all hygienists.
Hygienists.
You know, so number one, as a profession, why are we giving our patients something to do that we know they're not going to do? And for me, that's always been frustrating because personally, I hate flossing. I never floss unless I have food caught between my teeth. So that there's no misconceptions, flossing is important to remove food from your teeth. However, I prefer using a toothpick because it can get in better. It doesn't damage the tissues if used properly, and you're also massaging the gum while you're doing it. So I prefer using a good toothpick. Now, the reason why flossing doesn't work, if someone has gum disease, which means someone's lost the bone under their gum. So if you imagine there's healthy bacteria and there's unhealthy bacteria. The unhealthy bacteria is anaerobic, meaning they don't use oxygen. So where do they live? They live at the bottom of the pocket, under the gums, right? And what happens is, it's those bacteria that cause the infections and the inflammation in the body. So it's impossible to take a string and hold it with 2 fingers and get it to the bottom of the pocket. So in reality, you're flossing the top of the gum where all the healthy bacteria live. So there's nothing therapeutic about a piece of string. We prefer using something called an oral irrigator, which is more effective.
It is more effective because irrigation is like showering your gums. So you fill the tank with water, you get a little squirt gun that's attached by a hose, and you angle it toward your gum line. And when you're showering your gums, the water is shooting under the pocket, deep enough where the bacteria actually live, where they're nesting. And some of them even go deeper into the tissue and into the roots of the teeth. So irrigation is the most effective tool in lowering the microbial load.
Right. But if someone likes to floss, then floss. I'm not telling you not to floss.
It's not enough.
Right.
For people who have periodontal disease or bleeding gums, or even if they have healthy gums and their saliva comes back after tested, if it comes back as having like the top 11 pathogens, flossing's not working for them. So they definitely need to up level to irrigation.
Right.